Have you been told you have neck arthritis? Do you ever wonder what stage you're at or how bad it is and if it's going to get worse? Well, in this video, I'm going to go over very briefly the stages and levels of neck degeneration, and I'm going to show you the x-rays that correlate to each level. Hi, my name is Dr. Frank Altenrath, and I'm a chiropractor here in Cresskill, New Jersey at Valley Optimal Spine, and I'm trained and certified in chiropractic biophysics. What we do in our office is we take care of people with neck pain, low back pain, pain in the arms, down the legs, headaches, all types of musculoskeletal conditions, and we look to restore their spine and posture back to ideal alignment, allowing them to move better, bend better, lift better, and overall allowing them to have a much better quality of life. And if you like this type of content and you're new to my channel, I'd invite you to hit the subscribe button below and tap on that notification bell so you don't miss out on any of our fresh new weekly content. So I just want to go over this poster that we have in the office. It's a poster by Chiropractic Biophysics that explains really nicely in a summary form the different levels of spinal arthritis and disc disease. Now the green line represents the normal aligned spine. It follows the path of the posterior longitudinal ligament. And the red line represents the abnormal deterioration and the misalignment of the spine over time if it's not taken care of. So briefly, in the normal picture, we see that the spine should have a nice semicircular curve. The head should be nicely over the shoulders. This allows for the weight distribution of the head over the posterior elements of the spine, which are the facet joints, which are meant to carry the load. As the head starts to go forward over time, that load goes forward and it starts to go over the discs and the vertebral bodies. They're not meant to carry the weight. So ideally we want to see a nice semicircular curve where the spine is distributed, the curve is distributed evenly at each segment of the spine in an even distribution. Now, if there's an injury or there's some kind of trauma when you're younger, it could be a car accident, it could even be from bad posture, looking at phones all day, we start to see the spine lose its alignment. And here in level 1 and level 2, we see that the red line is now starting to move away from the green line. In level 1 here, we start seeing the red line move away in the top portion, but you're still seeing nice even disc spaces throughout. You're still seeing nice square bones, no arthritis yet. But in this case, even though it's only level 1, patients will present with headaches, muscle tightness in the neck. They might show some weakness in the neck muscles on orthopedic testing. But really, this can go unnoticed for a long time. Now, if this is not corrected here, we go into level 2. In level 2, we start seeing more of the red line going away from the green line. We start seeing the neck straighten out even more, which means that the weight now is going to be abnormally distributed over the discs and the bones, which are not meant to carry the weight of the head. In this case right here, patients will have pain, headaches. They may have numbness or tingling, which is common. You also start noticing more decrease in cervical range of motion. If things aren't corrected in level 2, we go to level 3, where you start seeing more of the red line for going away from the green line, but you're starting to really notice the bone spurs at the edge of the vertebra, and the disc space is becoming very thin. So in this case, now you're going to start getting bone spurs, you're going to start getting rough edges around the bone, and this is due to the body's attempt to compensate. So as the spine starts to lose its alignment and the biomechanical integrity of the spine is lost, what the body does in defense of itself is it's going to try to lay down more bone in terms of in an attempt to create stability. So the body will always give up mobility for stability when it senses there's a problem. And in this case, we're going to start seeing the bone spurs growing, and if this is not taken care of, eventually these bone spurs will grow over different segments and start to fuse the spine together. This is what we don't want. At that point, people are going to start getting severe pain, they're going to get headaches, decreased motion, and just quality of life will start to go down. If it's not corrected here in level 3, we go to level 4. In level 4, we start seeing a severe distortion of the red line over the green line. We see the disc spaces are practically gone. We start seeing rough edges and bone spurs everywhere. This person here could have now disc issues, herniated discs. They're going to have chronic pain now, chronic headache, stiffness, numbness, and tingling. And at this point, many times they're already too far gone for us to make a good impact in their life with the corrective care that we can provide. So many times here in level 4, we're sending them to go see a orthopedic surgeon or a neurosurgeon for a consult, depending on how severe their symptoms are. So the point of the story is we want to get people in this area right here that we can, get back to as close to possible as the normal alignment. So the idea is to take care of this as soon as possible so we don't get to level 4. So in summary, that's how the spine degenerates, as you saw in the last chart or poster, as it goes from level 1 to level 4 degeneration. And as corrective care chiropractors, we focus on correcting those misalignments or postural distortions, spinal distortions, so that we can get you back as close as we can to a normal spinal model, which allows you to live a much better life, taking pressure off your nervous system and preventing future degeneration and possible disc herniations, things like that in the future. So we hope you enjoyed this video, and until the next video, take care. Valley Optimal Spine is located on 80 Broadway, Suite 1A in Cresskill, New Jersey. Our telephone number is 201-569-1212.